Welcome to our discussion on integrative medicine. My name is Lee Acey. I'm with the Mayo Clinic Social Media Network, and glad to welcome Dr. Denise Millstine, who's a specialist or has a special interest in integrative medicine here on our Arizona campus. So we're in Scottsdale, Arizona. And Dr. Millstine, maybe introduce yourself a little bit and share a bit of your history and your interest in integrative medicine.
Sure, thank you so much. It's my pleasure to be here. I'm a consultant at the Mayo Clinic in Women's Health, and I direct our program in integrative medicine. I'm trained in internal medicine and board specialized in that, but I also did a fellowship in integrative medicine here through the University of Arizona, so that's my area of expertise. I spend time in the breast clinic as well, so I'm excited about our topics today.
Well, great, and I just encourage our viewers to please feel free to share this post on your Facebook wall, on your timeline. This is a live broadcast, so we really welcome your questions, so please do chime in with your questions. And also, if you do share it with your friends, give them an opportunity to participate live as well. All of this will be archived for later viewing. So maybe we'll just start out. Could you tell me, Dr. Millstine, what is integrative medicine?
Yeah, it's a great question because a lot of people are confused. So integrative medicine is what was previously known as complementary and alternative medicine, or CAM, but there actually is a consortium or a group of academic health centers who have a definition, a formal definition of integrative medicine. I wanted to read it, if
Sure.
you'd forgive me. So integrative medicine reaffirms the importance of the relationship between practitioner and patient, focuses on the whole person, is informed by evidence, makes use of all appropriate therapeutic and lifestyle approaches, healthcare professionals, and disciplines to achieve optimal health and healing. I always like to point out that the focus in integrative medicine is in health as opposed to disease management, and also that we really try to pull from all of the educated providers who we think can be helpful with our patients.
Okay. So what is encompassed by the term integrative medicine?
Yeah, so when I see a patient for an integrative medicine consult, I always talk to them about nutrition, exercise, sleep, mind-body practices, particularly how they're managing their stress, and then the incorporation of natural products, things like supplements and botanicals, and also other medical systems, things like traditional Chinese medicine, homeopathy, Ayurveda, all of that in the care of whatever it is that they're dealing with to optimize their health.
Okay. Why is it important?
So integrative medicine is important because it's really about that whole person approach. We all know the situation when perhaps we've had a critical medical diagnosis, and when we see our providers, we're very focused on our diagnosis, say a cancer. But each of us is more than that diagnosis. So integrative medicine fills out making you healthy as your body and as you're going through this battle with whatever disease it is that you have on your plate.
Can integrative medicine really have an impact on cancer?
Yeah, it's a great question. So we've just opened space for integrative medicine in our new integrated cancer practice space, and it's been phenomenal. But really what I try to tell patients is that integrative medicine usually doesn't manage the cancer itself. More often than not, it helps maintain health while you're undergoing the treatment for cancer. It also helps you be able to tolerate your treatments, because if you can't take the chemotherapy or you can't stand the way you feel while you're doing the radiation, if you can incorporate integrative medicine to get you through that journey, you'll be better off in the long run. And then integrative medicine has a huge role in cancer survivorship.
Okay. So what are maybe some of the top modalities that are used in cancer?
So first and foremost, exercise. So people who have cancer, if they exercise 2 hours a minimum per week, they live longer, they prevent recurrence of their cancer. So that's the top one, first and foremost. The second I've sort of mentioned, which is stress management. We live in a culture that's high stress, and we forget how important that is in our overall health. So finding ways to manage your stress and have tools to put it in check, because we all live pretty stressful lives, I'd say. And then diet. It's hard to be healthy if you don't eat healthy foods, or to feel healthy if you're not putting good things into your body. So those would be my top strategies almost always.
Okay. Just want to reiterate to everyone, easy for me to say, so I want to reiterate to everyone, if you have questions for Dr. Millstine, we welcome those, and Taryn from our team will be chiming in with those as those are coming in. So we do want this to be interactive, so feel free to chime in with your questions. And Taryn, if you want to just raise a hand whenever you have any of those, so we'll do that. How about acupuncture? When should someone consider acupuncture if they have cancer, or for other reasons?
Yeah, of course. So acupuncture is a very powerful modality. I think most of us think of acupuncture for pain. So many people seek out acupuncture for headaches or for back pain, and it can be quite effective for that. In patients with cancer, acupuncture has been shown to be quite effective in reducing nausea and vomiting. It goes back to what I was saying before. Your ability to tolerate your therapies can really be hampered if you feel terrible when you're getting them. So incorporating acupuncture in patients who are receiving medications or chemotherapy, I think, can be quite powerful. We also look at using acupuncture in the situation of radiation therapy, particularly when the radiation affects the head and neck for head and neck cancers. And that can be helpful with some of the skin and tissue changes that happen when radiation is done. I think of acupuncture as being energy balancing. So if you're somebody with cancer-related fatigue or fatigue from any cause, it's a good idea to think about acupuncture to see if you can get that rebalance from that therapy, which is really quite pleasant to experience, even if you're afraid of needles. They're so small.
Okay. What about massage with cancer?
So I think we consider massage to often be something aesthetic or something that you do at a relaxing spa, but it is an incredibly powerful therapy. In fact, I just saw a patient who was telling me how much her whole leg hurts from some arthritis that she has. And one of my first suggestions to her was to consider massage for that, because her muscles are tight and they need to be released a bit in order for her to feel better. So again, with cancer, if you have to take a therapy that makes you achy, I think massage can be quite powerful. Now I'll say, if you have cancer, it's important that you have your services in the hand of somebody who's trained in what's called oncology massage. So somebody who's a provider that knows areas to avoid if you want to prevent lymphatic drainage in a certain direction, for example, or if you've just had surgery, you want the provider to be familiar with what's okay and what's not when it comes to massage. And there are some really high quality training programs out there that will ensure the provider doesn't harm you.
Okay. How about supplements as they relate to cancer? How do those impact treatment?
So I think when you're diagnosed with cancer, you often want to see what you can do to help yourself be healthier. And of course, people come out of the woodwork, your relatives and friends who are well-intentioned and want to suggest something that perhaps can help your situation. A common misperception is if you buy it over the counter or if it came from a plant that it doesn't interact with your other therapies. And that would be my most important point, that just because it's natural doesn't mean it doesn't interact. So the most critical piece of information for the use of natural products in somebody who has cancer is to talk to their providers about it, to make sure that they're aware and they can check with a pharmacist or with a database to see, is that supplement interacting with, again, my chemotherapy, my radiation, or anything I'm undergoing for my cancer care. So that would be my overarching advice for supplements and products.
Yeah, I mean, I remember in my early days working in media relations at Mayo, there was a study about grapefruit juice and how that affected metabolism of some drugs. I don't remember what it was exactly for, but there's nothing more natural than grapefruit.
Right.
Grapefruits, and yet it was affecting the effectiveness of the medication.
Yeah.
Do we have any questions, Taryn? Okay. So just kind of in summing up, how would you, what advice would you give for somebody, whether in cancer or in other disease areas? What are the key things they need to know about supplements and integrative medicine and what role they have?
Yeah, so I spend a lot of time thinking about breast cancer. So let's just use that as an example. So what we know with breast cancer therapy is our conventional treatment for breast cancer works well. It's not perfect, but it works well. We save women's lives, men's lives too, all the time. So one critical piece with integrative medicine is that it can be something to enhance your conventional treatment, but not something that you do instead of. And we have a nice study that was published about 9 years ago now, showing that people who participated in what was then called CAM, at the exclusion of conventional therapies, didn't do as well as those who used the conventional therapies, and they did just the same as those who did nothing. So I always want to emphasize that this is not instead of care. And then I've already said about the communication. If you're choosing to work with another provider in your cancer care, be that anybody, a massage therapist, an acupuncturist, a naturopathic provider, a functional medicine trained physician, and also working with conventional physicians, it's critical that there's communication between those people so that nobody's working against each other and everybody's care is moving you towards the best.
Tell me a little bit about the program here that you're involved in. Do you have people that are those kind of providers that you mentioned that are part of the Mayo staff?
Yeah, so we have 4 fellowship trained physicians in integrative medicine here in Arizona. We've also just added staff to include 3 acupuncturists and 3 massage therapists who are phenomenally trained and talented. And then we also have yoga providers. So one thing we didn't talk about is how exercise is critical, yes, but different types of exercise can be really powerful in cancer. For example, some women with breast cancer get very achy from the medications they have to take, so resistance-based exercises are really excellent for that. Other people have cancer-related fatigue or anxiety or stress around the fact that they have to live with this question of, is my cancer gone? Is it going to come back? And yoga can be amazingly powerful for that. What we've made really important in our program is that the yoga is scalable, meaning anybody can participate in it. Whether you can lie down on the floor or stand on your head, or you have to just sit in a chair to do it, it can be effective for you regardless of your ability coming in.
Okay. And is there, this program is new. I mean, how new is it, and how did people find out, or how do people get involved in it?
Yeah. So we have actually been around for about 10 years as a network of providers, but we became an official program in 2015 and opened our doors on the Phoenix campus of Mayo in February of this year. So brand new. In terms of our consolidated space and offerings. If people would like to schedule an appointment with us, they can call Central Scheduling for the consults, and we also have a link, a digital link that they can use to schedule massage, acupuncture, and the yoga classes for themselves, so they can see what's open when they're checking that. And I think we're going to post that.
That's posted already, so great. We got that.
Fantastic.
Any closing thoughts?
Well, I think that integrative medicine is something that can really move the needle on people's overall health. So I guess I'd encourage people to think, if there's someone who has been going through the medical system and is getting some answers and is frustrated, or gets answers but still doesn't feel well, this is a great direction to start to go to complement all of the other important medical therapies that are being incorporated for their care.
Okay.
We have one question
Okay,
from Facebook.
great.
Someone says they have a daughter who has skin cancer and the cancer affects the whole body. Do you advise about how to manage the disease?
So the question is, her daughter has a skin cancer that affects her whole body.
Mm-hmm.
So I'm not a pediatrician, and I don't know if her daughter is an adult or not, but skin cancer, because it's so common, sometimes doesn't get the attention that it deserves. I would say if it's affecting the whole body, it would really depend how it's affecting her to determine how to direct her care. If it's a matter of pain, she might consider acupuncture. If it's a matter of just overall feeling tired, then again, the yoga might be really powerful, and focusing on diet and stress management is probably also important. There are several different kinds of skin cancer, so it also depends on which type it is.
Yeah, I mean, I think the key message is do talk with your provider, whether it's about the supplements you're taking and how they might be interacting, or also just to explore in your particular case which of these therapies, which of these modalities might make sense for you. The good news is we have a center here that helps you sort that out, right?
Right,
That's
exactly.
So thanks everyone for joining us. Again, we encourage you to share this on your Facebook wall, or to comment. If you have comments, we'll do our best to get answers for those as well, comments and questions. Thanks for joining us, and we'll be broadcasting again soon.
Thank you.